Hi guys, welcome back to Fairies Tutorials. Now, can you guess what today's episode is about? Can you? Yes, we'll be looking at eating disorders. Stay tuned. Guys, so we'll be discussing something that is very real and also something that affects persons negatively. We'll be looking at eating disorders, and the two that we'll be focusing on today are anorexia nervosa and also bulimia nervosa. Focus point. So, in today's session, we'll be looking at a description of eating disorders, types of eating disorders, the complications of eating disorders, the causes, and also treatment. Good? Now, let's kick things off with the foundation. So, we need to know what are eating disorders for us to put things into context and to fully understand the different aspects that will be discussed in today's session. Now, do you know a definition for eating disorders? Have you ever heard the term before? Now, what do you think are eating disorders? Good? Alright, let us see if you are thinking on the correct path. Now, eating disorders may be defined as severe conditions related to persistent eating behaviors that negatively impact your health, emotions, and the ability to function in important areas of life. Let's go again. Eating disorders may be defined as severe conditions related to persistent eating behaviors that negatively impact your health, emotions, and the ability to function in important areas of life. Now, guys, based on that definition, what do you think, or could you think of any causes of these eating disorders? All right, now let us look in details on some of these causes, right? So as you can see here, we have social influencers, genetics, the environment, childhood traumas, low self-esteem, difficulty expressing emotions, life stages, and also stress. Now let us look at them in more details. Good. So emotional shock or grief. So persons may lose someone, or they may have a bad relationship, they had a breakup, their whatever situation that is going on in their life, they're emotionally shocked. They may lose a loved one. Good. Now, stress over a period of time. So some persons may be stressed, so they, guess what, they may not eat enough, or they may overeat. An unhappy childhood, unhappiness about body size and shape. Also, unhappy relationships within the family. And some persons just feel like they need to have a control over their life, and the only control they may have is to decide what they eat, if they eat, or if they don't, right? Now, let us look at, those are the causes in general. Now, let us look at the different types, and in today's episode, we're going to only look at two types, and the first one that we're starting off with is anorexia nervosa. Now, this disorder affects mainly teenage girls and young women, and sometimes boys and young men. Now, a person with anorexia nervosa refuses to eat enough to maintain their body weight for their age and their height. So these persons may only consume like 200 to 300 calories per day. And depending on the type of, so for example, like put things in a little perspective. Now the time depends on the type of snack. What if like say for example a sweet biscuit or some form of chips or some juices, especially the carbonated beverages. Those items may be 200 to 300 calories per day. So just imagine the type of food that the amount of food that they're getting in their system. Remember, 200 to 300 calories per day. That's what, so it's that or less. So persons who are anorexic or suffer from this type of eating disorder, they refuse to eat so that their body can function properly, right? Now let us move on. These persons believe and sees their body much bigger than it really is, and they have a real and great fear of becoming fat. Good. All right. Now these persons experience quite a few complications or additional nutritional and health disorders, and you can just imagine why. Because if they're consuming less than 200 to 300 calories a day, when an average person should probably consume 2,500 calories a day, depending on their weight and their height and also their level of physical activity. Good. Now let us look at some of the things that may happen to a person who is anorexic. Good. So the first one that we're going to look at their brain. We're going to look at how are their brains affected. Good. So their brain, they can't think right, and they have this constant fear of weight gain. So they're moody, they're depressed, they have bad memory, and they oftentimes faint. Good. Now as it relates to their blood, these persons becomes anemic, right? So they may have the diet related health problem, iron deficiency anemia, and that is solely because of their poor diet. Good. Also intestines, they experience bloating and also constipation. Their muscles becomes weak and swollen. They easily have fractures to their bones, and they may develop the bone condition called osteoporosis. So because they're not consuming adequate amount of food to get the right amount of nutrients for their body to function and carry out its daily processes, then these persons experience a range of different health or nutrition related problems. Good. When it comes on to fluids, they are low in potassium, low in magnesium, low in sodium. Now these minerals are very important for us to maintain water balance. Good. Now their hair becomes thin and brittle, so it breaks off easily, and it is also thin. Now they have low blood pressure. They also may have palpitations. They have kidney failure. They may experience kidney stone. Their skins are bruised easily. They have dry skin, growth of fine hair all over the body. They easily get cold. Their nails get brittle. It is easily broken or torn off. And when we speak about hormones, we speak about bone loss, and also they have problems growing. Now in women, their period or their menstrual cycle may stop completely, and these persons may have difficulty getting pregnant, right? And even if they do get pregnant, they have a higher risk for miscarriages. They may have to have a C-section, and the baby now will have a low birth weight, and also they will experience postpartum depression. Good. All right. Now let us look on the flip side. We're looking at bulimia nervosa, right? And based on this image here, you can see where the image on the right where the man is eating, stuffing all sort of foods that he's eating from the fridge, and then guess what do you notice that it is happening? He's forcing himself to throw up. So we talk about binge eating, and binge eating refers to eating a lot, then self-induced vomiting. So they may put their fingers down their throat, or they may just take some form of laxative so that they can get the food out of their bodies. Now, patients with bulimia nervosa have powerful urges to eat very large amounts of food and then often make themselves sick or take laxative to prevent gaining weight. Now, bulimic patients often eat in private, hiding the problem from other people. Now, these persons may suffer from kidney problems and swelling of the tissue under their skin, which is called edema, muscle weaknesses, constipation, headaches, sore throat, and also severe dental problems, because they force themselves to throw up some more than the amount of acid that is coming up from the stomach will eventually let the enamel in their teeth break down, and by the time you know it, they have cavities. Good, right? Now treatment for these disorder. So an eating disorder requires treatment from a doctor, a therapist, and also a dietitian. Good. So a doctor for their overall checkup, health and well-being. A therapist to me talk about the issues that they're facing. Why is it that you're having an eating disorder? Is it that they lost someone? Is it something stressful that they're experiencing? Right? And it's also important for them to have a dietitian so that they can get a professional guide into what they're supposed to eat and what is best for their bodies. Good? Now that we're at the end of this session, guys, you should be able to answer or to complete these activities, right? These list of questions. So, describe the term eating disorders. What are eating disorders? List 2 types of eating disorders. Discuss 3 complications of eating disorders. State 3 causes of eating disorders, and also to list the treatment for eating disorders. How about putting these responses in the comments section? Awesome, you've made it to the end of the video. Don't forget to subscribe, like, share, and comment. Thank you for making it Fairy's tutorial.